Okay, we might get underway, and I'd like to welcome all of you here to Monash, and in particular to this presentation about our amazing four-year program, the Bachelor of Radiography and Medical Imaging. This is our 21st year here at Monash. I came here all those years ago and founded the program, the department, and we have gone from strength to strength. I'm Marilyn Baird. I'm now also Associate Dean Learning and Teaching for the faculty, and I think we are all extremely proud of our degree. We can say honestly that right now none of our graduates are without a job. At least a third of our graduates have gone on to become sonographers. We have chief radiographers, tutor radiographers. We have some of our graduates working for the multinational companies. One of our early graduates works in Germany now at Siemens, been there for many years, about to enroll in a PhD with us. We have a very good track record of graduating PhDs in the various disciplines. And right now, I'm going to introduce our amazing and wonderful course coordinator, Imelda Williams, who is going to explain this degree, but also for those who may be interested in radiation therapy and wondering if we offer an undergraduate pathway there, our Bachelor of Radiation Sciences is particularly structured to enable you to pass seamlessly into the graduate entry Master of Radiation Therapy. And at the end of this presentation, because we only have half an hour, please come and see us at the booth. We have our labs open as well, and we have one of our amazing students will also talk to you. But we have lots of things to show you this afternoon too, and happy to take questions. But we may not be able to stay in this room for questions because we're on a tight schedule for other courses. So without further ado, thank you, Imelda.
Thank you, Madeline. An amazing woman is sitting down there, for sure. She started the course, as she said, 21 years ago, and it's a course that's really recognized, not just in Australia, but also internationally as well. I'm quite sure if I would ask the audience, have you ever been in a radiology department, either as a patient or accompanying a patient? The majority of you will say yes. So I'm not even going to ask you to raise your hands if you haven't done that. But this is about telling you what the radiographers actually do, because you only get a snapshot with that interaction with the radiographers. So within radiology, we have got many modalities, and these modalities are used to create specific images so that a diagnosis can be made. So the radiographer's role is around the patient. They need to prepare the patient for the examination, they need to inform them, and we've also got various positions that the patient need to be prepared for to take those images. With radiography, of course, there's radiation. So it's really important that the radiographer can make those decisions about choosing the best protocol so that the patient gets the lowest dose possible. So here's just some of the imaging modalities, and I'm going to focus on general radiography for a minute. So there's also called plain radiography or X-rays. And within that department, there's fluoroscopy. Many of the females in the audience might know about mammography, and here's an image for mammography. And then we also have bone mineral densitometry. If you've been to the dentist, you might have had an orthopantomogram or an OPG. So here we have a patient having an X-ray of an elbow, and there is an image with fluoroscopy. Now, to give you an understanding of the different modalities, I'm going to use as a narrative the shoulder. So on this image, we have a shoulder, and where that arrow is pointing, there's a fracture. So this was done in the general X-ray room. Moving on to CT. So CT uses complex digital computing and imaging systems, and sectional anatomical images are created. Maybe just think of that previous image of the shoulder. This is the same patient. Can you see the difference that CT does in what we've seen with the plain X-ray and what we can now see with the CT scan? But CT has evolved tremendously, and it keeps on evolving with innovations. So here we've got an image of a beating heart, so they can look at the heart as well. They can look at various different body parts. Moving on to MRI, so magnetic resonance imaging, uses powerful magnets and again computer processing to create superior imaging. With MRI, there's no radiation. Again, going to the shoulder, this is not the same patient, but you can see, now we can see the soft tissue structures much better with MRI. We also have an image here of a very nasty tumor in the brain, and this is a side view of the spine, and it gives you a snapshot of the spine going down from the head down to the sacrum. Then we have medical ultrasound, where high-frequency waves, sound waves, are used to create diagnostic imaging, and ultrasound doesn't use radiation. So this is just an idea, again, with the shoulder, so you can actually look to the shoulder with ultrasound, and it gives you, again, superior imaging around the soft tissue. We've got Doppler studies, so we can look at the blood flow. There's blood flow in the neck. And then if you had a recent baby in the family, you might have seen some of these things. So ultrasound also has really evolved over years with soft tissue. This is actually in the last trimester of the pregnancy, so that baby is not out, that baby is still inside, but it really looks like you're looking at the baby from the outside as well. So to prepare our students to go out on clinical placement, we have a skills lab, and I would really like to encourage you, if you haven't done so, to do the tour to our skills lab. And because there's radiation involved, the students can't x-ray themselves. So what we have here is very enthusiastic first years putting together a phantom, which is similar than human tissue, so that they can actually perform x-rays. So they position the phantom, take x-rays, and they can, of course, also do some research around radiation with the phantom. We also have an ultrasound skills lab where students actually scan each other, and that happens in the third year of the study. So the main features of the course is it's a 4-year integrated program, which means that the academic and the clinical goes hand in hand. So we prepare our students from year 1, semester 1, for each of their placements, so that when they go out on clinical placement, they are not wallflowers, but they can actually x-ray the patients. And with each of those placements, the students are tested before they move on to the next semester. So the curriculum is taught in relation to imaging modalities. So in the first 2 years, there's a focus on the general x-ray. When we get to the third and the fourth year, there's a focus on CT, ultrasound, and MRI. So with clinical studies, rotations start from year 1. So from year 1, students go out on clinical placements. We also ask our students, in fact, our students do have to go to different places every time. So it could be the big hospitals, it could be private or practice, but they also have to do either a regional or a rural placement, which means at the end of the course, they've had experience to different placement sites, they've met possible employers, and of course, they write their CV as they go along. So if they're good students and they apply for positions at the end of the program, quite often they will be remembered and they will be offered a job. When we get to the fourth year of the program, the fourth year is different than our first 3 years. We split the cohort in half. So one half is out on clinical practice, so they take an extensive period of clinical practice where the focus is still on general radiography, but there's rotations to CT as well as MRI. And the other half is on campus where they do academic with a focus on more advanced practice and research. So here's a snapshot of the program. So for the first years, in semester 1, you can see there's science and practice, and wherever you see science and practice, it's linked to the clinical work that they have to do. There's a physics unit and there's biology. Now, for some of you sitting here might not have biology or might not have physics, please don't be afraid if you don't have physics, because I think the key thing is always, I haven't had physics, am I going to fail? Once the students are offered a position in our course, they get access to a physics bridging course, and the academic who looks after the physics, in those first couple of weeks, he makes sure that every student is on the same page, so that all of them can progress seamlessly through the program. And then, so general radiography in the first 2 years, and when we look at the third year, there's CT, there's ultrasound and MRI, and then the fourth year is where we have the split cohort. So the ones on campus have a choice in doing either research or topics in medical imaging, which is advanced, and then they also do advanced medical imaging as well, and the other cohort will be out on clinical practice, and as I said, there's general radiography, CT and MRI. So as you can hear, clinical studies is really integral to our course. While the students are there, we use a sophisticated software program, PebblePad, where they document and capture everything that they do while they're on clinical placement. And it's competency-based assessments, because at the end of the day, we need to ensure that the public is safe when our students are out there. We have got agreements with many sites where our students are going to, and this is just some of the sites as well. We also have interstate placements as well. We use novel teaching approaches within our program, and one program that we're really very proud of is ISAP, which is Integrating Science and Practice, and it's something that's actually been adopted now by other departments within our faculty, and is challenging the students around critical thinking. Then we have the Values Exchange Program, and that is around clinical thinking when it comes to cultural, ethical, and moral issues. And then I've already mentioned PebblePad, which is an electronic portfolio that the students have. When they finish from the course, they can actually export everything out, and that's part of their CV when they start applying for jobs. So I've talked about, if you think of the holistic approach, there's 3 H's. The first H is the head. That's the knowledge that you need to have, and that's why the academic side is so important. The second part is the hands, the skills, how to position the patient, and that's what we do in our skills lab and when they go out on clinical practice. But the other H is the heart. That is the soft skill, where our students should have these personal attributes. They should have a desire to work with people, to help patients. They should have very good communication skills, and they should be able to work within a team environment, because very seldom will the radiographer be totally on their own. It does happen, but that is in the minority. So you have to be good in terms of teamwork. And because your patients don't always come as textbook to you, they don't always come walking in, some of them are in wheelchairs, you have to adapt your technique. So critical thinking is important. You need to problem solve right there and then. How am I going to adapt my positioning so that I can still give the best image for that patient? And of course, time management is important. And it's not just important in terms of clinical, because some of those departments are very busy. You want to get through those patients as fast as you can. But time management is also important with the academic studies as well. So this is an important slide. So the selection requirements for 2019. So units 3 and 4. So look at the VTAC guide, and then a score of at least 35 in English or 30 in any other English. You need to have a study score of 25 in either physics or biology. If you have both, wonderful. But it doesn't mean you can't get into the course if you've only got one. And then for maths, also 25, either maths methods or specialist maths. And for those of you who have studied further, if you've completed tertiary studies, at least a distinction of 70% across your tertiary study. So for 2019, we envisage that we'll be able to take 65 students. The clearly in ATAR score is 97.9. The lowest ATAR score that came into the course was 88 point, I think it was 8, because we can apply C's bonuses as well. And this is an important email. If you've got any further questions around the course that you want to know, first point of contact is that email. Please email inquiries.radiography@monash.edu. Got one of my administrators here. They're really very good in trying to direct. If they can't answer, they will ask whoever is the most appropriate person to answer your question. But before the students go out on clinical practice, there are some checks that they need to have. It's a police check, working with children check, immunization, and they should have completed a first aid course to be undertaken at level 1 first aid, including CPR. When the students graduate from the course, they get registered on the professional body, which is APRA, which means that they can start working immediately. They don't need any further supervised practice to be able to work. And we provide that list to APRA. Graduates from the course, we've got a professional body called the Australian Society of Medical Imaging and Radiation Therapy. They can get a statement of compliance from them. So once they've finished, what can they do? The opportunities are really fantastic. So they can work in a general X-ray department, and there's lots of things I've already showed you. There's mammography, there's fluoroscopy, and so forth. And then they can be a specialist radiographer either in CT or MRI, or they can do further studies to become a sonographer. And then with some of our multinational companies like Philips and Siemens, they can become an application specialist. They can do research and then also become one like us, academics. So if you're very interested in teaching as well. So why come to Monash? At the moment, the only course fully recognized at AQF level 8. So that's why when our students graduate, they graduate with honours, all of them. Our course is recognized not just within Australia, but in the majority of countries. And I say majority because the Americas are always a little bit funny. And then we give lots of opportunities to our students. So within our course here in Australia, but we also have international placements. And this is the second year, and just some of the places they went to. So there we've got 2 of them in England, Botswana, Abu Dhabi. I've got one of our lovely students here, Georgian. She's going to talk to you, and she just went to Scotland, Israel. And of course, it's not just about working in the departments, but also experiencing some of the cultures. So these are 2 of our students who went to Thailand. Of course, once you study at Monash, we want to keep you at Monash. So you have got opportunities to study further. So with the Master of Medical Ultrasound, again, you get advanced standing. If you've done our undergrad course, you get advanced standing to do a Master of Advanced Healthcare Practice, and you can do also postgraduate research. Okay, so now I'm going to move on to another degree, which is the Bachelor of Radiation Sciences. The Bachelor of Radiation Sciences puts you on a path to become a radiation therapist. So with radiation therapy, they use cutting-edge imaging modalities because you want to detect cancer, and then also planning tools. So they use advanced 3D imaging planning tools, and then also precision equipment to treat the patient in the most safest way. So with CT, so you can see there's a little bit of overlap with our medical imaging degree. They use digital computing to create and detect cancers, and here we can see there's a cancer that's been detected. They use powerful magnets as well. In the end, they can create these targeted images. And then they use those data from the imaging to create a specific treatment plan for each of those patients. So within the course, the curriculum is taught in relation to anatomy, pathology, imaging, and they use a virtual planning system so that the students start working on planning. There's also some clinical studies included within the Bachelor of Radiation Sciences, so in 2nd year and in 3rd year of the course. So again, just a snapshot. So everything that's in green in this table is interprofessional teaching. So a lot of the stuff is linked, that's similar to some of the other courses, and quite often that's taught at our Caulfield campus. The units in yellow, that's very much with our medical imaging, so aspects or maybe completely some of those units that they do. And the ones in blue, that's starting to prepare the students for the radiation therapy and cancer. So clinical studies, they've got a 2-day clinical orientation in second year, but in third year there's a 4 weeks of clinical practice. And here we have got Peter Mack, and just with its wonderful facilities, so the students get exposure to clinical practice. So the selection requirements for 2019, the English score of 30 or 25 with the English. They only need maths, so it's either 25 in maths methods or specialist maths, or a study score of 30 in further maths. So the difference that you can see with this program and the radiography program is there's no physics or bio requirement. We'll offer about 40 places in 2019, and the clearly in ATAR score is 83.75. You also notice the contact email is exactly the same as for our other program. So for the Master, as I said, this is a start of a journey into the Master of Radiation Therapy. If you do the Bachelor of Radiation Sciences, it's an accelerated pathway for you. The Master of Radiation Therapy is currently being accredited by the Medical Radiation Practice Board of Australia. And again, graduates from the MRT program can apply for a statement of compliance from ASMET. So, why would you want to do the BRAD science? It fast-tracks you into a master's. So normally a master's program would be 2 years. If you do the BRAD science, it's only 18 months, which means you save on HECS fees, so you will graduate with a master's degree. Also with the Master of Radiation Therapy, we also provide, we source the clinical places for radiation therapy as well. And here we've got one of the graduates from the program, the lovely Rachel, who said the opportunity to work with an industry, to be able to be out there and to actually see what happens with the patients who has been diagnosed with cancer. So why do this degree then? It's the only radiation science degree that's directly linked to a master's degree at AQF level 9, and it provides a pathway to transfer into the Bachelor of Radiography and Medical Imaging. So for some of you who might really want to do the Bachelor of Radiation and Medical Imaging, there is an opportunity to apply for internal course transfer after the first year of studies, but we can only take a limited number of students. So if you want to go that pathway, you really have to work very hard. We only take the top students for transfer. And then if you've got any questions, once again, the point of contact is the email. I'm now going to call on Georgia to give us a quick chat on her experience within the course. Thank you.
Hi everyone, thanks for coming. Nice to see lots of people here today. As has been said, my name is Georgia. I'm currently in my third year of Radiography and Medical Imaging here at Monash. As a bit of background for you, I moved from my hometown in southern Tassie back at the start of 2016 to study here. And in terms of how I got into the profession, growing up, sport was always a really big part of my life. I was a really active participant in rowing, athletics and netball, which was a really great time in my life, but unfortunately, much to my parents' disappointment, did lead to a lot of sporting injuries. So I spent a lot of time with physiotherapists, sport doctors and surgeons. At the time, I was really lucky to have a great sport doctor who took a keen interest in explaining to me like the anatomy and pathology present in some of my images and how some of the technology was used to create those images. I was also really lucky to have the opportunity to do some work experience in Year 10 at school. So I spent 2 weeks working in 2 different radiology practices in Tassie, which really just confirmed for me that this was the right industry that I wanted to work in. Fast forward almost 3 years, and this course has taken me further than I ever could have imagined. I've completed so many placements, both in public and private clinical placements in Victoria, interstate back in Tassie at home, and as you saw before, I went to Scotland last year for an international placement. Last year I was lucky enough to go to Aberdeen with one of my best friends, which was one of the best experiences I'll take from the course. I could stand here all day and ramble on about how many skills I've developed since working here, how this course has changed my life and the memories that I'll be able to take on from it. But to keep it simple, there are 3 main things that I love about this course. Number 1 being the people. As you can see, it's a really small cohort, so there's 60 odd people in my year, In comparison to other courses like engineering or science or arts, there's like a couple of hundred in each year. So you develop a really close-knit family environment, which is really important. I won't lie to you, this course is tough. It's really tough. So having that support network around you is really helpful. The placement. Straight from your first semester at uni, you're exposed to the clinical setting, you're treated as a professional and you're given responsibilities. You're given actual real-life patients. It's very exciting. This is very different to a number of other medical degrees, such as even medicine at Monash, where you're almost at uni for 3 years before you learn any actual real-life clinical skills. So straight away, even if you find that you don't like the course, you find out very, very quickly, very close into the course that you'll work out whether or not this course is for you. Lastly, the direction you're given, but the flexibility is still available to you. As Imelda has been through, there's so many different opportunities available to you once you graduate. You graduate as a radiographer, which for me personally, that's really important because I think I'd really struggle to do a course like arts or science where you're given a lot of direction once you finish. It's a very broad, like open-ended course and you can take it wherever you want, which is great if you're an open-ended person, but for me personally, I need direction. But having said that, I'm also very indecisive. So I like being told that, you're going to be a radiographer when you finish, but it's still not closed in as you're only going to be a radiographer forever. You can work in general X-ray, you can work in CT, you can go and do postgraduate study. There are so many opportunities available to you. I wanted a job where I'll never get bored, and I think I've found the industry that can do that for me. I know how difficult the decision can be to decide what to study, where to live, and which direction to start your life after school. If you have any other questions that you want answered here today, whether you want more specifics about the subjects you'll be studying, anything like that, living on campus. I've been here for 3 years now, so I can help answer any of those questions. Please come and find me. I'll be here until 1:45, just in the booth outside. I'm happy to give out my email if anyone wants to contact me with any more specific questions, so just come and find me. It's no problem at all. Thanks.
Thank you. We won't be able to take questions now, but we have a Q&A session which will start at 1 o'clock, and that's in the M2 Lecture Theatre. So if you've got any further questions, we can do that. So if there's anyone that's interested in the Master of Radiation Therapy, I think there were a few questions around that. On the 9th of September, it's a Sunday, between 10 and 2, there will be an open day, and that is at Peter Mac.
Yeah, but also everybody, Peter Mac opens up its X-ray department and its nuclear medicine department. So put that in your diaries. That's Sunday, 9th of September. You saw the beautiful building on the slide, the Peter Mac Comprehensive Cancer Centre at the top of Elizabeth Street. It's worth just going there for the coffee shop. It's absolutely amazing. The coffee shop on the 6th level, you walk out and you look over the whole of the city. It's really lovely. So, is that it?
Yeah, so if any of you've got more questions, the booth is still there. You can come, but also come to the Q&A session as well.
So thank you
for being here.
Thank you, and Imelda, thank you. Wonderful job. start with Hogan saying his.
I think we just need to introduce whoever's here on the panel, and then we will start with the graduates because they haven't had a chance to speak.
Really? No, you don't have to.
Oh, you don't have to. Off the cuff, how wonderful you are. That's all. That's all. Let's just wait for 1 o'clock to arrive.
It's a Q&A session, is it? Or?
Yeah, it's more Q&A, but with you, we haven't had, because I thought...
I'll go
So
back and
that's why
see.
we've got you and Pratik here. So we'll give you a chance to just tell us a bit about yourself. We've got Georgia here, so any questions they want to ask her, she told them they can ask her questions. Yeah. Okay, we'll just... Hey, it's good to see you.
Likewise, I'm sorry I'm late. I had to drop my dad off to the airport last night at 2, so...
Okay, good afternoon, and thank you for coming to this presentation. Actually, it's not a presentation. This is an opportunity for you to ask any questions. I'm going to introduce the panel that we have here so that you have got an idea what kind of questions you can ask. I'm Imelda Williams. I'm the course convener for the Bachelor of Radiation and Medical Imaging. And then I've got two of our graduates here. We've got Pratik and we've got Hogan. And Pratik 2 years ago, Hogan last year. So they are going to tell you a little bit about themselves and what's been happening since they've done the course or what the course have done for them. And then we've got Georgia, and Georgia is one of our third-year students, and she was a class rep as well, and she had an experience in Scotland, so you can ask her questions. And then we've got Michal, and she's the director for research. So I've given my talk, so I'm not going to talk again. I think wherever you've heard enough of me. But there will be another talk at 2:15, but most welcome to ask questions. So I'm going to start off with Pratik, and he's going to tell you a little bit about himself. So you can either use that one there.
Oh, yeah. Okay. Hello, guys. My name's Pratik. I'm a radiographer at Dandenong Hospital with Monash Health. I've been working there for the last 2 years and a bit now. And yeah, I've got a big interest in teaching, and we have students all year round, which is fantastic. So, you know, I love what I do. Every day's a new day. It's a unique experience. Doesn't feel monotonous, and there's just so much to learn and do. I'm working a lot with surgeons and stuff up in theatre, which is great. So I'm building a lot of interprofessional relationships and skills that way as well. So it's opening up a lot of pathways that way. And I'm doing a little project in the department as well at the moment, looking at how we actually sort of check our equipment and doing regular testing and things like that. So I'm able to contribute something back to the department as well. And otherwise, I'm involved in a lot of professional development activities where I get involved with our committee and society. So I'm doing a lot of stuff that way as well. Yeah, that's a little bit about me.
But Pratik forgot to tell you that in his final year of studies...
Yeah. In my final years of studies, I did a research project looking at radiography students' attitudes towards patients with disability, because my younger sister has Down syndrome. So it just sort of prompted me to kind of look at, you know, how do other people in my profession, especially students, look at disability and how they treat their patients and sort of what impact that has. And that was really cool. You know, I got to survey the year levels. I think Hogan did my survey as well. So that was pretty good, and that's something, you know, good came out about that, and it's just sort of an area of passion of mine. I'm hoping to pursue something like that in the future, or sort of, you know, sort of mentor students to sort of deal with disabled patients and sort of, you know, pass that knowledge on.
And you got what award?
Oh, yeah, what award did I get? I totally forgot. I got an award for...
A student presentation for...
Oh, yes, that's right. It's been a while. So I presented that paper at a seminar, and I actually won, which was quite shocking because there were some really good talks that day. And I got a $1,000 prize to go present at a national conference as well, which was great. So I went to Perth, all paid expenses, had a great time there, presented there, and won again, which was really cool. And then, yeah, I think I have a knack for public speaking, but I don't feel like it.
Okay, thanks, Pratik. And then next we'll have Hogan, and he's one of our graduates from last year.
Hey, how are we going, guys? So I'm Hogan, a new grad at Alfred Hospital. So I graduated from my Bachelor of Radiography last year. In the final year, you get to choose between doing a lit review and a research project, and it gives you a kind of a good opportunity to kind of take what you've learned in the past 3 years and then apply it to something that you're kind of more passionate about. And also, the Monash course in general allows you to progress not only personal but kind of in a professional way, and you kind of see it starting from first year, like you come from high school or whatever, and then by the time you finish fourth year, you're in theatre with orthopedic surgeons, and you're in emergency X-ray and doing quite high level stuff straight off the bat, and it's kind of a really good course that prepares you for what's to come in the future. So basically, I did my internship as part of Alfred Health, and that allowed me to split my time across Alfred Hospital in Melbourne itself, as well as one of its regional centres in Bairnsdale, and between the two, I got a large aspect of the public health system and everything in general, in terms of you get the trauma and the kind of the really large-scale things at the Alfred, and then you can go to Bairnsdale and see how more like an elderly population or different kind of patient backgrounds. So in terms of that, working in the field of radiography, it allows you to see a lot of different disciplines work in an interprofessional approach, giving that kind of mix and match as opposed to just one field itself. So you'll see orthopedic work, which is prosthetics into the human skeletal system. So you'll see reduction of fractures, and orifing, which is fixations, and intermedullary rods placed into the femur and stuff like that. So the course itself kind of really prepares you for that kind of thing, and it's kind of a great stepping stone. So at the moment, I'm actually getting CT trained, which is another part of radiography outside of general X-ray. Which is also a great opportunity that the Monash course is so varying in the fact that it gives you a lot of time in CT, ultrasound, and magnetic resonance imaging. And so, kind of separate to other courses, we give in-depth detail into this to then allow, students to get a feel for when they come out into the practice and get qualified, that they remember back to what it was like, and maybe they'll want to specialise in the future to that kind of thing. With Pratik as well, so with my research project, I worked with Dr. Matthew Dimmick, who's one of the physics lecturers here, and we worked on a project with the Auckland Bioengineering Institute, the Victorian Institute of Forensic Medicine, and Monash University to create biomechanical models for patients suffering from cerebral palsy. And it was just kind of a good opportunity to see that, again, interprofessional practice come in place, working with different people at different institutes to see how you can communicate and work as a team. So I also presented at the paper day, and which is the professional body learning, and as well. So that was really good, and I probably wouldn't have got there without the support of kind of how the degree folds out, because it's quite a good opportunity to learn as much as you can and grow not only professionally and learn a lot about your field that you're going into, but personally as a person as well. As in, you're going to mature and kind of shape into a medical professional a lot earlier than you would probably expect. So
thanks to this, so you would have noticed that we are winning all the prizes, whether it's within the state of Victoria or nationally, because both of them actually won the national prize in the end in diagnostic imaging, and it says a lot for our course. Now I'm going to let Georgia tell you a little bit. She did talk when we had our presentation. She is one of our third-year students. So just a little bit about the course as well. And then Michal will talk about a little bit about the Q&A. Yeah. And then after that, we'll do Q&A.
Hi guys, a few of you probably already know me from this morning, but I'm Georgia, third-year radiography student. I definitely do not have as many awards and accolades to my name. Standing next to these guys, I feel a bit inferior.
Next to you.
But yeah, I'm a really big advocate for this course. I absolutely love it. I really enjoy the clinical placement time that we've had. So I've been really fortunate to have done 2 placements interstate, 4 in Victoria and 1 overseas as well. So it's taken me in so many different directions that I think, I probably sound a bit biased in saying this, but I wouldn't have had the opportunity to do these things at other unis offering the same course. So I think it's a really big selling point for Monash. Yeah.
Thanks, Georgia. And I'll just ask Michal, and we know it's a Q&A, but we haven't talked about research, just to give a little spiel about the research.
Yes, thanks, Imelda. Just really briefly, our graduates can come back and enroll in a Master of Philosophy or PhD, if they want, and take them onto a research career, which opens up a whole new spectrum of work and opportunities, not only in their own field to specialize, but also to come back and maybe teach, get involved in the university, become academics, become like us. And the cycle turns around and they teach the new graduates again, as Pratik's already indicated he's interested in. So there are enormous opportunities. Our department's got a vibrant research arm, which normally I talk about in the presentation, but not this year. So we have over 20 PhD students, and they are radiographers, sonographers, radiation therapists who come back to us after a few years, and they then engage in a research project. And we prepare our students from year 1. We give them scientific writing lectures, bit of research methodology, and it all culminates in year 4 when they have the option, if they want to elect to do a research project, just like Hogan and Pratik have done. It pays off. They can publish, present, and it just does wonders for your CV. And puts me on a different category altogether. So there are incredible opportunities for those students who want to go down that way. But this is a Q&A session. It's the first time we've run it, so it's different. So we wanted to pass over to you and ask any questions you have to the students or us, and we can then, go from there. Anyone has any questions that they want to ask the students maybe? They're here to help.
This lady looks like she wants to ask.
Did you want to?
Do you mind taking the mic?
I just want to ask about the Master of Ultrasound course. So how do we enter that into that? Can you enter into that?
You have a graduate degree to do that, but if you have done our Bachelor of Radiation and Medical Imaging course, then you will get advanced standing into the Master of Ultrasound, because as you've heard, we cover quite a bit of ultrasound within the course. So that would allow you to do the Masters in a shorter period. Am I right that it's 18 months for them as well?
So the graduate diploma is about 2 years part-time, and the students usually, once they graduate, they will, usually their clinical site where they're working will say that they want to sponsor them for their training, because you need to do the academic work and the clinical work alongside, and then they can enroll. And they keep working, and while they're working, they can do their graduate diploma, which is 2 years part-time. Sorry? You finish radiography, and then you can go into the graduate diploma. You can then go also on and do a Masters of Medical Ultrasound, which is an extra year. No, the Bachelor of Radiation Sciences is not. It doesn't allow you to graduate as a radiographer. It's a pathway degree.
Any questions? So can you get into radiography if you don't have bio or physics? Yes. You can use the Bachelor of Radiation Sciences which has got, for the requirements, you need to have maths, but there's no requirement for physics or bio. But in the first year of that degree, they do a lot of physics and bio, so it's a pathway to then apply as an internal course transfer into the Bachelor of Radiography. So after the first year, they can apply for transfers. You don't have to complete the degree, but after 12 months, you can apply. But you have to work hard, because only the top students will in the end get accepted into the radiography course.
Sorry, but what's the ASAP for the Bachelor of Radiography?
So for the Bachelor of Radiography for the 2018 intake, it was 97.8. Okay, that was clearly in ATAR. The lowest ATAR that got into the course was 88. The reason why there's a difference is because you can apply for bonuses, the special excess bonuses. So if you have if you are in a disadvantaged area, or if there's financial hardship or any of those things that you can apply for, that can then increase basically the ATAR score for you getting into the course. And over 90, yeah.
I would encourage you to apply. You have a good chance.
Don't get put off by the high ATAR.
Don't worry, I got a 70 and I still got in. So,
How did you do that?
I just did really well my first year of science. I got an 85 average.
Oh, you did first year science.
Yeah.
So there's another option, either the Bachelor of Radiation Sciences or the Bachelor of Science at Monash. But you have to study at Monash to be able to apply for internal course transfer after the first year.
Just on that note with the C's side of things as well, don't discount that if you are really worried about your ATAR. For example, I had an accident in year 11 and missed 3 months of school. So I was also able to use that pathway to help me get in. So don't discount that if you have anything like that going on in your life to help you out.
If there are opportunities, you can also do biomedical science. Or
Yeah.
And then do the internal course transfer. But you do need to get good marks.
Yeah, that's the main thing is because our course, it's limited because of the clinical placements. We make a guarantee to all of our students in the course, we will find you a clinical placement. And it's competitive because there's 3 universities offering radiography. So we ensure that when our students go out from year 1, semester 1, we will find places for them. It's only in year 4 where it's different, because our students, and that will change actually, but in year 4 it's a much longer extended period of clinical placement as well. And that's why we can only take in limited numbers. So for the ones who came in late, have you got any questions? Because this is basically what our Q&A panel is. We've got some of our graduates, I've got a third year, I've got the director of research, and I've got myself who's the course convener. So if you've got any questions, please use the session to ask.
You can get very crowded out the front, so
Yeah.
we are trialing this out to see if that is better.
Is there a possibility if the student is like an elite athlete, is there a leniency to change stuff, like to work with them with their training schedules and stuff like that?
Are you talking about if they an athlete,
Yes.
a professional athlete? The university has got something which we call special considerations. So it depends what activity they need to be involved in, and also when that activity falls. So sometimes there's national events taking place, and that does get taken into consideration. But the students have to apply for those special considerations and have proof of what they're going to do. Because sometimes these things happen during exams. So the university does take that into consideration. So if you are involved in sports, by no means don't think you can't do radiography.
But it is a heavy time commitment, right?
Oh, yeah.
Yeah. Any questions? Don't be afraid. We're here to answer. Prospectives?
You guys all know what radiography is, right? No, seriously, like, because when I applied in year 12, I didn't go to Open Day or anything, and I was just going through the websites about like seeing like what I could actually go into and what I was going to do, and I was like, oh, this looks pretty cool. There's just, you know, X-rays and CT scans and ultrasound, and I was like, oh, this sounds pretty cool. So I didn't really know much background. I just went with it. In my first year, I was like, I'll just decide if I like it or not. And it kind of just like, there's so much to do and everything you can do. So it kind of really blew me away a little bit. I was like, oh, I didn't even know anything about this, but now you'll have friends that do it, or someone in your family has done it before, or like radiography is such a small world that you'll begin to like have, when you graduate, you'll have friends at the Austin Hospital, Dandenong Hospital, Alfred, you know, and you'll get together and talk about what different things that you do or how your place does it differently. So the field is quite niche in the fact that it's like a big family, and we will take care of our own. So.
I would actually underscore what Hogan says. And you find it when you go to conferences. When you go there, you are never someone who would not know anyone when you're there. There will always be at least one or two people that you will know. And it doesn't even matter if you go international conferences as well. Because as Hogan says, you actually marry into a family. You don't know it, but you're going to get sold off into radiography. So you are there, and we hope to have you there for life. I mean, I've been doing it for so many years, I don't want to say when I started. And I'm still not thinking about doing something differently because it offers just so many things. It changes so much over the course. Yeah?
Since like radiography, medical imaging is like very specific course, like are you like expected to know certain things about it when you go in, or like do you teach everything from the start?
Yeah. We don't send you out with an expectation you're going to learn while you're out there. We prepare you for that clinical placement. So for each semester, so starting from year one, we prepare the students from year one. This is the expectation that we have for a first year, first semester. We need to have them ready to go out and to be able to do what you would expect from the first year. And we also convey that to the clinical centers as well. So they would know, for example, if the student goes out first semester, first year, they should be able to x-ray an arm or a leg or a chest. But if they get to third year, now we're looking at the other modalities. They should be able to, now we're thinking about CT scans, they should be able to do, say, a CT of the brain. But that's prepared because the curriculum is taught within whatever they got, the expectations is for them for that semester. So they are prepared. We can't let the students loose and hope everything will go okay, because at the end of the day, it's about the public. You have patients, we have radiation, so we have to ensure that our students are safe when they're out there, and that the patients will be safe under their hands. So you are well prepared when you go out. Yeah?
Sorry if this has been asked already. What ATAR are you guys looking at this year?
So the clearly in ATAR is 97.8 for Bachelor of Radiography. And as I mentioned before, there's the CES bonuses that can be applied, and the lowest ATAR that we had coming into the course was 88. And the Monash guarantee is 90. So if you've got an ATAR of 90 and plus, please apply. And then if there's anything where you can apply CES bonuses, and as Georgia said, she had an accident for 3 months and she applied, and that was applied, and that lifts the ATAR score up as well. Yep.
Did you guys address the common thinking that working as a radiographer is like pushing the button?
Oh, forget about that. That's been so old school.
Look, I mean, yeah, it's way more than that. You won't believe how much we have to do. You know, we're the radiographer, we're the IT person, we're the HR admin person, and sometimes we have to be a little bit like a radiologist. You know, doctors will come to us for our opinion. You know, what do we think of this image? What's wrong? You know, that kind of thing. So it's been a lot more than just pushing a button. I completely disagree with that statement. We just, there's so much that we do in our profession, in our workplace. It's ridiculous. Did you want?
Yeah, not pressing buttons at all. Oh, your thumb does get a little bit sore in theatre, though. You do press a lot of buttons in theatre. No, it's not. you can't, if you thought radiography was just about putting a patient in front of a detector and just pressing a button, well, you wouldn't get a very good x-ray. And that thinking is also kind of, you need to think about the ethics, I guess, in providing a service to a patient that is not only like kind of good in their prognosis in general, in terms of you need to provide the service that is diagnostic. So you need to know all the different angles about when you take an x-ray, look at the x-ray, you need to critique it for how you could fix it if it's bad. So it's not all about just putting a patient in front of it, pressing a button, because if the x-ray is non-diagnostic, the patient's going to get some pathology missed. The radiologist might come back and say, well, this is not what we're looking for. So it's all about different techniques that you can do to then go and adjust your technique in terms of taking the x-ray. So, and yeah, as Pratik said, I have had many night shifts where I'm up on the ward taking a mobile x-ray. They've got about 6 junior doctors around, started working there for about 3 weeks, and I take the chest x-ray from an urgent met call patient, and all the doctors just looking at the x-ray and then looking at me, and I'm like, and they're like, oh, what's your opinion? Because they don't even really know what they're looking at. So it helps to work on your feet, and it is a very technical field and a lot to remember. And if you don't render that correctly, then it's not only dangerous because you're dealing with radiation, but also possibly really adverse for the patient if something is missed, and something could happen along the line that, if in hindsight that you performed the additional view or whatever, could affect them kind of deeply.
Yeah, I just wanted to add that this field develops so quickly. And really, once graduated, these guys need to keep educating themselves, because the equipment develops, the software changes, and there's always so much learning to do. So it's not like you finish and you know what you're going to do for the rest of your life. It changes all the time. It really is mind-boggling, some of the equipment that's coming on the market. And every conference we see new stuff coming in, new things they can do. Radiologists perform interventional procedures, really high-tech stuff, and they need radiographers alongside them to guide them. You know, anything from a breast biopsy to aneurysms and stent placements. So there's so much work and so much diversity where radiographers participate with the surgeons, with the radiologists. So that notion is really outdated.
I might just add to that as well.
Do you have another question?
Prerequisites for year 12.
You just want to finish off on that question?
Yeah, sorry, just going back, it's just a question I'm really passionate about. I'll be completely honest, this course wasn't my top preference in high school. I wanted to become a radiologist. So that was kind of how I got into the field. I wanted to get through medicine. Very long course, didn't happen. But having said that, I went on work experience, and I did get the impression from not knowing much about what they're actually doing. I didn't have probably the best person to supervise me and take me through things. It did look like they were just pressing a button. But when I came to uni to actually learn stuff, like the amount of diagnostic pathology stuff that you learn, particularly in second year, like you will be absolutely gobsmacked. You know so much more than you're like legally allowed to tell the patient, just because, yeah, you're not the person to tell the patient, hey, you've got a broken arm. Like, it doesn't mean that you don't know it. Particularly if you're working like in a private practice, you need to know that pathology. In an outpatient practice, you need to be the person that recognises, hey, this is a brain bleed, and you need to know that to be able to send that patient to emergency so that they get that care. So it's not at all that you don't learn that stuff, you do. So yeah, just wanted to add that.
I think just before I come to your questions about the prerequisite, we as a university preparing radiographies to be registered with the profession, which is APRA or the MRPBA, there's certain requirements that we need to meet. And there's a document called Professional Capabilities, and one of those is some of the stuff that they've now mentioned, identifying significant findings, which means you might find yourself without a radiologist who can immediately give a diagnosis. But if you see something on an x-ray and you know the referring physician or whoever sent that patient needs to know about that now, you must be able to recognize that. That is a requirement. So we're not pushing buttons anymore. We are also looking at the images. They need to adapt their technique, but to be able to identify certain pathologies so that they can alert immediately if something has been picked up. It could either be they tell the radiologist, you need to look at this case now and give a report because this patient can die. And it can happen that if it's not conveyed, that a patient can die because of the delay in getting that report out. And that's where we prepare our students for. So they're able to recognize that and immediately tell someone, I've seen this. They might not be 100% right, but at least they're alerting someone to look at that case. Your question was about prerequisites. So the English, there's maths. For the medical imaging, you have to have either specialist maths or maths methods, and then either physics or biology. So if you don't have physics, don't feel afraid, because a lot of the students coming into our course will come in with biology and not physics. But once they are enrolled in our course, we've got a bridging program, a physics bridging program, which they do. And the academic responsible for that first year unit where there's a lot of physics, he'll always make sure that the students are on the same page so that nobody's left behind. And the students without physics are just as successful as the students with physics. So don't be afraid. I don't know if any of you had, she didn't have physics.
I had physics.
He had physics and you had physics.
I'm okay. I did, but to be completely honest, I didn't completely finish it. I really struggle with physics, but it is definitely doable. Definitely.
No, chemistry is not a prereq. So it's either physics or biology. And if you don't have, I think it's your daughter next to you. She's got maths, methods, and chem. So if she really wants to do radiography, there are pathways to get into radiography. She can do the Bachelor of Radiation Sciences, which doesn't have a prereq for physics or bio, but in the first year they do that. So in the first year, she can apply for internal course transfer. Or she could do a Bachelor of Biomedical Science, which has got the biology, and after the first, apply for internal course transfer. Yeah? Yes. So if you really want to do radiography, and you go either for Bachelor of Biomed Science or Bachelor of Radiation Science, you have to work very hard, because we can only take a limited number, so it's the top students that will be able to apply for internal course transfer. Because we only have, for next year, about 65 places. And we've got our year 12s finishing, we've got internal course transfer, so we are limited. And our limitations, if you see the class, we can take lots of students in classrooms, but we can't guarantee we can give them clinical placements, and that's why we have those limitations. Yep.
That's a really good question. So I'm at Dandenong Hospital. It's a big orthopedic place with a pretty busy emergency center. And, you know, we deal with, on average, 60 to 80 patients with outpatient clinic daily on top of ED, which is a variable number. You can't put a number on that. And then we also deal with inpatients. So we prioritize, you know, patients depending on clinical urgency, and we've got rooms allocated to different types of patients and stuff. So it's pretty dynamic. You know, one moment I could be an emergency. Emergencies calm down. Then I jump over to outpatients. I help clear up the outpatient. And then if outpatients is all good, then I jump into inpatients and I help out the people working in inpatients. And sometimes if I need to go to theater, the next moment I'm upstairs, changing to scrubs in the operating theater, you know, screening for a surgeon. And then I'm back down, lunch, and then maybe they'll say, oh, look, there's an urgent met call up in the ward. I need to go do a met call. So it's quite dynamic. At least at Dandenong, you know, and then maybe later in the afternoon I have to go to fluoroscopy and do a barium meal screen for a patient. So I like that sort of that dynamic environment and the challenge it poses, because it keeps me on my feet all day and keeps me engaged, you know.
Yeah. And of course, it's also 24-hour service.
Yeah, 24-hour service. So we have afternoon shifts, day shifts, early shifts, night shift. Yeah, so flexibility is good.
So you have shift work.
Yeah.
It's not mainly shift work, so it depends where you work. So if you're in a big public hospital, they might start you right off the bat doing shift work, maybe on call, after hours x-ray, that kind of thing. But other places will require a bit more training first. But in general, as a radiographer, yeah, you're, as Pratik said, you're bouncing around inpatients, outpatients, emergency, trauma, theatre, mobile x-rays, ICU as well. ICU is a really big one because when you go into ICU, you kind of need to be very self-aware that every patient in there is very, very sick, very vulnerable. And so everything you do, you need to kind of liaise not only with maybe your other radiographer that you're working with that night, but also the nursing staff and the doctors looking after that patient, because I'm not sure if anyone's seen ICU patients before, but they're usually intubated, which means a machine's breathing for them. They've got lots of arterial lines and central venous catheters and stuff like that that are feeding medication into their system. They're constantly on kind of sedation. So when you go in there, you're not going to get any response from the patient, but it's important that you still treat them like you would treat any other patient, supply them with a service that is diagnostic and correct, and kind of work with other staff to get that done as a safest kind of possible thing. But in general, a radiographer, it's more than just a one-trick pony. It's you work in a multidisciplinary team with. So the Alfred Hospital has a major trauma centre, so it's classed as an A-level trauma centre. So anything that other hospitals can't handle, or that's so traumatic, pelvic injuries, C-spine injuries, burns, that kind of thing, comes straight to the Alfred. So we're not paediatric, so I don't get many children, but all adults that are in serious car crashes in the country will get airlifted to the Alfred, come straight through the doors into emergency or into the trauma bays. We'll x-ray them on the table while they're being initially assessed. So it's quite neat. You put the detector under them and you run away into your booth. You're prepping and you say, chest x-ray, trauma 1, and like about 30 people just run out of the room. You take a quick picture and they come back to the patient, start working on them again. So it's a really neat place to work in different public centres, and I know a lot of public centres work like that around Australia as well. So.
Can I just add something? If you had listened to what Hogan had said, he graduated last year from the course, but he's actually working in CT, which is one of his specialist areas. He's working in a big trauma hospital. Normally, it would take almost 2 years because there's so many staff that want to work in those specialist areas that would say, I put my hand up, I want to go and work in CT. But here we've got someone who graduated at the end of last year. He's already working in CT. And just as a testament to how the course prepares our graduates to go into those specialist areas.
For your safety, if you'll be exposed to blood and open wounds and things like that, you would need to be immunised.
Yes.
I would say, hepatitis A and B.
Yep.
How often do you see traumatised patients with blood and guts everywhere?
Oh yeah, give it to me.
Those sort of things I can't handle.
Okay.
My son wants to be in that sort of field. But
Yeah, yep.
you need to be a strong character to handle this.
Yeah, but the thing is, you don't have to work where I work. So you can just do a 9-to-5 job in a private clinic somewhere, just doing x-rays, CT scans, MRI scans on outpatients who walk in. They're clean, no open wounds. They've come from their GP with a doctor's request. We evaluate the request and we supply that service. So in the emergency setting, in terms of hospitals and public hospitals and stuff like that, that process is kind of skipped because they're picked up by the ambulance, they're picked up by the helicopter. We might get a page saying, this person's coming in, ETA 15 minutes, so everyone goes around there, gets ready, and you kind of prepare for the worst in terms of we wear eye protection, gowns, gloves, face masks if it's really bad. But you need to always constantly think about blood splatter, that kind of thing. But the way we work and the way we're trained, we're immunised, we work safely because we follow hospital protocols in the best kind of, in the way that they're supposed to be met. And the hospital protocols exist to keep the staff safe. So, and patient safe, sorry. Yeah, and so the patient is the first priority. But, Sometimes it's a little bit different, because if the patient's the first priority, then the people working on the patient need to be kind of a priority too, because if the people working on the patient aren't a priority, then the patient can't get the care that they need as well. So everyone needs to be safe, and precautions are taken in order to do that. But in terms of working in a trauma centre, yeah, we see a lot of amputations, burns, that kind of thing, and sometimes the ambulance might cover them up before they're brought in, but sometimes they might be so rushed to get the patient's vitals back up that they'll just be on show. So you've got to kind of be prepared for like thoracotomy and laparotomy, which is opening the chest and opening the abdomen in trauma bays when everything goes south in terms of getting the patient vitally stable as opposed to managing anything else that's going wrong with them.
Could I just mention, just before you give to Georgia, for our students though, as you said, you can't handle it, maybe your son hopefully can handle it, but if there's an incident at a hospital where they think that there needs to be debriefing, the hospital will debrief the students. So if there's any kind of incident like that, but they will also inform us. And we would interview the students as well to find out if they need more support around that. Because sometimes things happen out, and it can happen with, and as you know, some of the staff members, if you read the newspapers and things, and I'm not talking about radiography, but nursing and so on, because we have got incidents with patients who are drug infected when they come in. So we make sure that there is support around the students, and the hospitals are very good with that. They would, as a first port of call, they would debrief the students, and whatever resources there are, but they would let us know. And if needed, we will also provide resources from the university.
Just quickly, I don't mean to be stereotypical, but for all the girls in the room, when I first started uni, in our first week or second week, we were introduced to cadavers, so people that had donated their body to be like dissected or looked at in labs. So it's very confronting first on. It sounds, I just saw your face, it sounds revolting and it will make you feel a bit squeamish, but you do get a bit desensitized to it. Like for example, last year when I was in Scotland, I had the opportunity to go into an autopsy. And looking back, had I been told that in my first week of uni, I would have been like, no thanks, not doing that. But it gets a lot easier over time. Like you definitely get desensitized to it, and like you still have the compassion, but you don't get quite as freaked out or revolted by it as you will. Like the longer you do it, the easier it gets.
Professional boundary.
Yeah, definitely.
And then at the end of the day, just if you're squeamish, it's not like you can't do.
Yeah, there's different avenues
Yeah,
for sure. Like yeah, exactly. You can go and work in private if you don't want blood, or not to say that private's always like that, but
yeah, exactly.
yeah,
But
just different categories of patients that you're likely to get in different places that you work. So.
And how many students complete the course? Is there a percentage of dropouts?
Our percentage of dropouts is very low. It's sometimes the whole cohort would go right through without any dropouts, but you might have one. It's never more than 5. But what you could find is that some students might find that radiography is too, it's not what they really want, or they find it too taxing, and they might actually try and transfer into another course as well. But the completion rate of our course is very high. Just on that note about squeamish stuff, and from our own experience, the first time when I went to theatre, I fainted. And it wasn't even an open thing. It was just, they were putting in screws into someone's thumb, and it sounded like a workshop. I thought, but what's going on here? But after that, I've worked in theatre after that for so many years, so you get used to it. Yep. Sonography? It's sonography and ultrasound is the same thing. Yeah. So within the course, we have got ultrasound as well, but it doesn't prepare you to be a sonographer. You will do aspects of it. We do some of the methods on how to scan a patient. You'll do a lot of the physics of ultrasound within the course, but if you want to do ultrasound, you have to study further. That's the grad certificate that you do, and you can go on and do the master's as well.
At the moment we do.
So at the moment, all of the students within our course, so the paid internship is not paid by the course, it's actually paid by the Department of Health of Victoria. So at the moment, all of the students in our course will complete the course in the 4th year with a paid internship. But that is going to change and that's why we're not talking about paid internship anymore, because from next year onward, students enrolling into the course, there will be no paid internship. They will offer scholarships though. So there will be opportunities for funding, but it's not like we currently have that all our fourth year students, if they do their internship, they receive a salary. That is definitely going to change from next year onwards. And it's not us, that's the Department of Health.
That can change again in the
Yeah.
future. We don't know how long, if that will be like, the new government, they change it again. So we don't know, we are in their hands.
What is the salary for range?
No, I don't.
Shall I leave it up to you guys? I think we should probably be waiting on.
Well, it varies quite rapidly. You'll meet a lot of people who say private is the best avenue to go into. It depends. If you go into private, then they don't have to pay off a public kind of system. So they pay a percentage of, or how their workers, how much they think their workers earn, more deserve. However, having said that, in the public system, you'll be with a grading system. So you start out grade 1, year 2, and it goes up every year after that. And then once you hit grade 1, year 5, you can apply for reclassification for grade 2, year 1. And it goes all the way up to grade 7, which is chief radiographer. You start out surprisingly good in the public sector in terms of the overtime, shift work, and on-call work you do. So for like on-call, for example, if I'm called in at like 1 in the morning or something, I'll get paid double time for 3 hours, even though I might just take one X-ray and go home or something like that. It doesn't happen often at the Alfred, but a lot of centres are like that. So that gets a lot of clunk to your salary. But I started off, base is $60,000 a year, and then on top of overtime, on call, that kind of thing, you can be looking around maybe 85,000 if you're working quite hard. Yeah.
Not bad.
It's look, considering you come straight out of uni, it's very good. Yeah.
I think there's another session after. We'll probably just have maybe 1 or 2 more questions, and then we'll have to wrap it up. So anyone with a burning question at the moment that we can answer while we have our lovely panel here? You're all good now. You've got all the answers that you need. So thank you so much for coming to the session. As Michal said, we've trialed this for the first time because we thought it would be just to give a different aspect to how we deliver our course. And I really want to say thank you because Pratik and Hogan was supposed to work at the Alfred today, but...
I'm actually on call at the moment. So
we're not paying double time. So thank you to both of them for really giving up their time. And we have graduates that quite often don't mind coming back and just supporting our program throughout. So thank you to all of you guys. We really appreciate your time. We'll have another information session at 2:15. So if any one of you want to know more about the course, there's a dedicated session at 2:15 in South 1. Okay, thank you. Thank you, guys.
Always happy to help you.
Yeah.
Always count on you.
So you're on call today?
Okay, we'll make a start, 2:15. Good afternoon, everybody, and it's lovely to see you here for this information session. Thank you for coming. My name's Marilyn Baird, and 21 years ago I started this degree and founded the department, and in the last 21 years we've also added radiation therapy, medical ultrasound to our program brief. We have had an amazing track record in graduating over 10 practitioners with PhDs due to the amazing enthusiasm of our Director of Research, Mikhail Schneider, who is over there, and our wonderful course coordinator, Imelda Williams, will introduce the course to you. But I think what I just want to say before I get off the stage is to say that if you join us for life. We want to look after you. We have a plethora of postgraduate programs. We have up to 63 clinical partners, and our numbers are relatively small. So if you come to Monash, you're part of the Monash family, and we really welcome you. So thank you, Imelda.
So I'm very glad you're doing that, because she really deserves that. Because without Marilyn, there wouldn't have been a course at Monash. I don't think so. And she's really, her interest, her heart is totally within radiography. She's got a husband, but I think he makes up about 10% of that. 90% is for radiography. She's really got a passion for not just for our course, but all of the courses that we run from our department. So I'm the course coordinator for the undergrad program for the Bachelor of Radiography and Medical Imaging. And I'm quite sure that most of you would have had some experience with the radiology department, either as a patient or maybe going with someone to the X-ray department. And your experiences would have been different, and the reason being there's so many modalities within radiology. We've got our general X-rays, we've got CT, we've got MRI. So different modalities that still provide the imaging so that the diagnosis can be made. So the role of the radiographers are, firstly, to inform the patients when they get there what kind of examination they're going to have, to prepare them and to put them in specific positions, because for each of those modalities or projections, patients need to be in different positions. So radiographers play a pivotal role when it comes to the selection of the protocol for each patient. Because there's radiation involved, they need to choose the protocol that will deliver the lowest radiation to the patient. So some of the general radiography, and that is not the full extent of it, is our plain X-rays. For example, here we have a patient undergoing an X-ray of an elbow, fluoroscopy. So here they're looking at the bowel of the patient. For the ladies in the audience, some of you might have had a mammogram. And then for bone mineral densitometry, and if you've been to the dentist, they might have referred you for an orthopan tomography. Now, just to give you a sense of how these modalities actually fit together, I'm going to use the shoulder as a narrative to direct you through all of the modalities. So here we have a shoulder X-ray, and that arrow points to a fracture. So you can see what we're able to see on this specific image. Now moving from the general X-rays into computer tomography. So CT uses complex computing systems and imaging systems to create sectional anatomical images. Now if you think about that previous shoulder that I showed you, this is the same patient, just a different machine. But can you see how much more information we can now get out of the CT scan? But that's not all that CT can does. It can do some amazing stuff. So here you can see there's a beating heart going on there, but also they can do fly-throughs through the bowel. So CT has developed a lot and around the software. With MRI, uses powerful magnets and also computer processes to create superior images. So MRI doesn't use radiation, so there's no X-ray exposure with this one. They use magnets, But again, looking at the shoulder, this is not the same patient, but you can see the difference between those images. Here we can see superior imaging of the soft tissue that's involved in the shoulder. And in the middle, we have an MRI scan of a very nasty tumor in the brain. And this is a side-on view of the spine. And we can see it's almost knit together so that you can see it right down from the patient's head right down to the sacrum as well. And then we've got medical ultrasound, which uses high-frequency sound waves to create diagnostic images. Again, no radiation. Getting back to the shoulder, this is how the patient is scanned. And with ultrasound, you can look at the soft tissue. So very good at looking at soft tissue structures. We have here the Doppler study, which allows us to look the vessels within the body. And then with this image, for those of you who had little babies or recently or so forth, with ultrasound, that has really changed quite a lot. And this is actually an image of a little baby while the baby is still in the mummy's tummy. That's in the last 3 months of pregnancy. So you can see that ultrasound has evolved a lot. It almost looks like you're looking at the baby outside of the womb with ultrasound. So we need to prepare our students to be able to position patients, different positions, but also for different modalities. But the first thing we need to do, and especially in the first year of studies, is around the general radiography. And we have got a radiography imaging skills lab, and the students can't x-ray each other because it works with radiation. But we use phantoms with an equivalent of human tissue, so they can position the phantom and then take x-rays of the phantom. And here we've got some very enthusiastic first years putting the phantom together. And there we've got 2 of our students actually taking x-rays of the phantom. We can also use the phantom to do some of the research. We also have an ultrasound lab, and that's specifically in year 3 where there's a big focus on ultrasound, and the students scan each other within those labs. So the main features of the course is that it's an integrated course, so the academic and the clinical really works hand in hand. So when the first years go out, first semester, we prepare them for what we expect them to be able to do as a first year, first semester. When they come back, we prepare them for what they need to expect to be able to do at the end of a first year. So every time when they're on campus, they are prepared for the clinical placement, so that when they go out, they're not a danger to themselves, to the staff, or to the patient. It's really important that we can ensure that there is safe practice when it comes to our students. So the curriculum is taught in relation to image modality. So in the first year, there's a focus on general radiography. In the third year, we start looking at the CT, ultrasound, and MRI, and I'll talk a little bit, or I can talk about the fourth year. So for the fourth year, we split our cohort in 2, and there's an extensive period of supervised practice. So they're out for almost 24 weeks on clinical, where they do rotations to CT, MRI, but also still general radiography as well. So you will notice that clinical studies is really important in our course, and it runs right through the course for each of the semesters. And this is just a snapshot. It looks extremely busy, but it is extremely busy for our students, and one of our students will talk to you just now. So in the first year, you'll see there's physics, there's biology, but then there's a unit that has science and practice, and that is the units that link to clinical practice, and you see it runs through the course as well. So in year 1 and year 2, general radiography. When we get to year 3, now we introduce CT studies, ultrasound, and MRI. With the fourth year, as I said, we split the cohort in 2. So for the ones who's on campus, they do either a unit where there's a focus on research, where they undertake a research study, or the other unit where there's selected topics in medical imaging, and all of the students will do the other unit, which is on advanced medical imaging, where there's a focus on advanced general radiography, but also again with CT and MRI. And the group who's out on clinical practice, they will spend time in general radiography, CT, and MRI. So while the students are out on clinical studies, we need to ensure that they meet the requirements for the unit while they're out there. So they get tested, and for that we use Pebble Pad. So the assessments that they do gets captured on this e-portfolio, and that's done by our clinical tutors as well. But they also have to do reflective studies about their time while they're out there on clinical practice. So very much competency-based before they move on to the next semester. We have got agreements with variable sites across the state of Victoria, with the big hospitals, with private practices, with regional and rural, and you can see this is just a list of some of those, and we also have opportunities for interstate placements. We use a lot of novel teaching within our program, and one that we're really proud of is the ISAP, which is Integrating Science and Practice. It was developed by our department, and it really challenges the students to think critically about a scenario. I must say this has now been adopted by other departments as well. Then we use values exchange, and there students are given scenarios which has to deal with cultural, ethical, and moral issues. And then, as I mentioned, we've got Pebble Pad, which predominantly is used while they're out on clinical, but we are also using some of those aspects within the academic assessments. Now, because this course prepares the students holistically, there's 3 H's that you've got to think about. The first H is the head, the knowledge that the students need to have. They need to have the right knowledge to be able to go out and practice safely. The second H is the hands. They need to be able to position the patients in those different positions. But the third H is a soft skill, and that is the heart. And for that, we look at the attributes of the student. So if you are interested in doing radiography, you need to have a desire to work with patients, to help people. You need to be able to communicate quite well, because for radiography, you've got a short space of time with the patient, and you need to tell them exactly what they need to know so that you can ensure that there is success once you've completed the examination. And then you very seldom work on your own, so you need to be good to working within a team. Our patients that come in, none of them are stock standard. They can sit exactly in the same way, lie in exactly the same way. That doesn't happen out there. So they need to be able to solve problems immediately, decide how I can adapt, because this patient can't do certain things, but I still need to provide a diagnostic image. So critical thinking is really important. Time management as well. So time management, because if you go into an X-ray department, some of you might have seen a whole row of patients waiting to go in. So you don't want someone who wastes time instead of getting the patient done. So they need to be very efficient with their time. But that also translates into the academics as well, because it's a really intensive course. So there's lots of requirements for the students to be able to meet all of the assessments that they need to do. So time management is really important. This is an important slide because it captures the selection requirements for 2019. So consult the VTAC guide for 2019, and they need to have completed units 3 and 4. With the English studies scores, they need to have 35 in English or 30 in any other English. And then they need to get a score of 25 in either physics or biology. So for those of you who maybe have done biology, not physics, because I know students are normally scared of physics, if you come into the course, we provide a bridging course in physics, so that it's an online course that the students can do, and then the academic responsible for the first year unit makes very sure that the students can actually understand the physics so that they are on the same page. And I can say we don't have a fail rate because of the fact that students haven't had physics. The students are very successful without the physics in the course. And then for maths, you need to have maths methods or specialist maths. And then for those of you who might come in as mature students and who've completed tertiary studies, you need to have at least achieved a distinction of 70% across your studies. So for 2019, we have approximately 65 CSP places, or Commonwealth supported places. The ATAR score of 97.9, and then also the clearly in ATAR for 2018 was 97.9, but there's also the CEAS bonuses that can be applied as well. If you've got any queries though, if there's anything which we can't answer, that is your first point of contact, to email inquiries.radiography@monash.edu, and our administrators, if they can't answer the question, they will then direct it to someone else. Before the students go out on placement, there's some requirements. They need to have a police check, working with children check, immunization, and have completed a first aid course. On graduation, the students graduating from our course will be registered immediately with the professional body, and that is recognized by the MRPBA. What that means is on graduation, so once they have passed, we provide a graduate list to APRA, and they get registered as practitioners so they can start working immediately. Also, we have a professional body, the Australian Society of Medical Imaging and Radiation Therapy. They are eligible to apply for a statement of compliance. So, once the students have graduated from the course, what can they expect of this profession? They can work in general radiography. As I showed you, there's lots to do in general radiography. There's mammography, there's theatre work, so there's DSA work that they can do. Or they can specialize in CT, in MRI. If they want to specialize in ultrasound, they have to study further, so they can't specialize directly into ultrasound. But if they've done the course at Monash and they apply to do ultrasound to study further, they will get recognition for some of the work that we do within the course in ultrasound. And then they can go and work for some of the big companies like Philips, because they can become application specialists, which is kind of cool, because normally you hear them, oh, they're overseas somewhere or somewhere else, because it's around the new technology. And then also if they sell a new CT scan to one of the clinical centers, is the application specialist who goes and prepare the radiographers how to use that new equipment, how to understand the software. Or they can go on, they can do research, and of course they can become academics like us. So why choose Monash? Our degree is awarded with honours. It means that all of our students completing the four-year degree will pass with honours. We have a very good international status. We also provide opportunities for our students to go abroad, and I've just got a few slides here. This is our second-year students. They undertook a 4-week placement, so there's two of them going to England, Botswana, Abu Dhabi, Scotland, Israel, and they can experience the culture as well, apart from working in the X-ray department. So we had two that went to Thailand quite recently. So opportunities to study further. If you want to do ultrasound, you can apply and do the graduate certificate in ultrasound and go on and do the Master of Medical Ultrasound, or you could study and do a Master of Advanced Healthcare Practice, and also the opportunity to do postgraduate research. Okay, so I'm just going to tell you a little bit about the Bachelor of Radiation Sciences. So the Bachelor of Radiation Sciences is a pathway to start you towards becoming a radiation therapist. To do the Master of Radiation Therapy, you need to have an undergrad degree. So with radiation therapy, they use cutting-edge imaging modalities, and the main thing is to detect cancer, and then they need to plan the treatment and then they've got to treat the cancer in the safest possible way. And here they make use of CT. So you can see there's some overlap with what we do within our medical imaging program, and they use those imaging to detect. Here you can see there's a cancer that's been detected. They can use powerful magnets, but in the end they can create these targeted images where the focus will be on the treatment. So here, for example, we have the data that's been used, and a dedicated treatment plan is then put together for each of the patients. So if you do the Bachelor of Radiation Sciences, anatomy, pathology, imaging, and treatment planning, that's taught within the undergrad degree. They use for the planning a virtual planning system, but within that degree, there's some clinical studies as well, which is undertaken in second and third year of the course. Just a snapshot of the program, so the undergrad degree. So everything that's in green is interprofessional teaching. So some of the teaching takes place at Caulfield campus, and some will take place here at Clayton campus. That which in yellow is aspects of our medical imaging course that they do. And then if you see the blue, and you can see heavily within the final year, that's preparing the students for the radiation therapy science and the cancers. So the studies that they do, in the second year they do a 2-day clinical orientation, but in the third year they have a 4-week clinical orientation, and here we have Peter Mack. So a really good experience for the students. So requirements for 2019, again they needed to have completed units 3 and 4, and the English study score as well. But for the maths, they can have 25 in maths methods or specialist maths, or a study score of 30 in further maths. So if you haven't done maths methods or specialist maths, you can come in with a score of 30 in further maths. You will notice no physics or bio. In the selection mode, there's approximately 40 places, and the clearly in ATAR score for the BRAT science is 83.75, and C's bonuses can also be applied. So the pathway, going from a Bachelor of Radiation Sciences into the Master of Radiation Therapy, so it's an accelerated pathway. The Master of Radiation Therapy is currently under accreditation by the MRPBA, and on graduation from the Master of Radiation Therapy, those graduates can also apply for a statement of compliance from the professional body ASMET. So why would you want to do the Bachelor of Radiation Sciences? It allows you to complete the master's degree in 18 months. Normally, the master's in radiation therapy will take 2 years, but if you've done the Bachelor of Radiation Sciences, you will get advanced standing, which means you actually, the master's program is 6 months less. So you save on the HEX fees, and you will in the end have a master's degree. And here we have Rachel from the course just saying that having that opportunity to be out in clinical practice was wonderful, because it shows you the impact that you had on patients' lives and their families. So why would you do the BRAD science at Monash? It's the only degree that's directly linked to a professional master's degree. It's linked to the Master of Radiation Therapy. But for those of you who really want to do radiography, you don't have the physics or biology, it's a pathway into radiography. So after the first year, you can apply for internal course transfer into radiography. Now, before I get to the questions, do we still have time?
Can I yes, we just have, just to clarify, it was pretty scary to see our ATAR at 97 for radiography. Remember, that is a product of the number who apply, but the lowest ATAR was 88. So, and the Monash guarantee for next year is 90, but there is a lot of eligibility criteria around that. So don't get distressed. my strong advice, every year I say this, if Monash is what you want, put us as your first preference. We can't get to you if you put RMIT first. You have to put Monash first, the computer then will rattle down, all right? It's sometimes a bit hard to understand that. But we had 1,000 wanting a place last year. That was the problem that shot the ATAR up. We're very popular, but we also are mindful, and we do want to encourage everyone who'd like to. We'd love to give a place to everyone. Also, if I could just remind you, there is, put in your calendars, 9th of September is a Sunday from 10 a.m. to 2 p.m. That beautiful building you saw, the Peter MacCallum Comprehensive Cancer Centre at the top of Elizabeth Street, has open day. And it can show you the work of radiation therapists, radiographers and nuclear medicine technologists. So that's the 9th of September, and it's open to anybody. Thank you, Imelda.
Okay, thanks. I'm going to call on Jeremy Kilgore. He's one of our fourth-year students, to tell you a little bit about his experience in the course.
Hello, everyone. I know I did take a couple of you on tours, so it's nice to see you back. So the question is, why did I join radiography? Like a lot of students in year 11 and 12, I didn't know what I wanted to do. So I decided to come to an open day. And I remember sitting in this same presentation about 4 or 5 years ago, listening to Imelda's presentation. And it sounded like a really interesting and direct pathway into making a difference in people's lives and helping healthcare progress and becoming a part of that team. So I found the course so far to be an incredibly engaging, and it's a much more direct course than a lot of courses in the sense that it's leading directly into a career pathway rather than a generic degree where you're left almost on your own to find something. The tutorials and lab sessions and lectures, they're all designed to prepare us for what's out there in the workforce. And the clinical placements that we have each semester for the first 3 years, and then for one semester or a whole semester in the 4th year, it's all designed to prepare us for what's out there. We get to work with lots of different radiographers and lots of different team members in hospitals and clinics all around Australia. And it's wonderful to be able to see all those different environments, and we get an idea of what kind of workplace we want to be in. So what impressed me most is that the tutorials and lab sessions, all of the lecturers are very invested in us becoming the best radiographers we can be, because they want us to make a positive difference for everyone else. It's not just about going to lectures and then doing your exams and then hopefully passing your units. It's all about getting the best outcomes for our patients. And yeah, that's what motivated me to come into it, and yeah, I hope it does for you too.
Thank you, Jeremy. I'm not sure if we've got any time for questions. I'm not sure, is anybody after us at 1:45? I just want to check now.
I'm not sure. Or maybe there are people waiting. Any questions anybody would like to ask? Any questions? Yes?
You did a degree in rad science, and then you decided you didn't want to do radiotherapy. Is there a role in the master's, say, of ultrasound if you changed your mind?
There's a problem with the ultrasound insofar as the expectation from the industry is most are radiographers, but there's nothing to stop a graduate from that degree trying to find their clinical training place. But after this is over, I can direct you. There is a university in Queensland that offers direct entry into medical ultrasound at the bachelor's level. And also, I'm also asked often by science graduates, can I go into a master's program in radiography? There are 2 universities in Australia that offer a Master of Radiography, and that's the University of Sydney and Canberra University. Any other questions? Yes?
If you haven't done biology or physics, is there any way to get into the medical imaging course?
Look, what I often suggest to people is to go back to school, get a job, and at night school, whatever, you can do it through TAFE, do the year 12, because then you're not incurring HECS and you're earning some money to save up to come to uni. Of course, the Bachelor of Radiation Sciences is the option. You don't need either of those as prereqs for that degree. It's the mathematics and English. And the reason for that is because the first year of that course is shared by the Bachelor of Public Health, and there are a couple of other bachelor degrees that share those units. And then you could apply for internal transfer. But note, as Imelda pointed out, you need to get a distinction average. So apart from that, we have had the odd nurse transfer, from a Bachelor of Nursing, Bachelor of Science, but you need to pick up 2 units, that is semester 1 and semester 2 in physics. Any other questions?
Could I please ask, I noticed you said you could do a Master of Medical Ultrasound as a post-grad.
Yes.
Does that imply that after doing the initial Bachelor of Radiology and Medical Imaging, you cannot do ultrasound?
You're not a sonographer at the end of the Bachelor of Radiography and Medical Imaging, you're a radiographer, but as Imelda pointed out, you've done sufficient study that you'll get advanced standing into that degree. Now, it is called the Master of Medical Ultrasound, which is a 72-point master's, but in reality, to practice as a sonographer and to be eligible to be on the registry of accredited medical sonographers in Australia, you actually only need a graduate diploma. So what all our people do is you enrol in the masters and you exit at the 48-point as in the graduate diploma of medical ultrasound, but you get at least 6 credit points in the 48 credit point diploma. Now, the person who leads that program is out on the table out there, Paul Lombardo. He'd be very happy to talk to you. But no, the Bachelor of Radiography and Medical Imaging prepares you on day 1 to deliver radiographic services in general radiography, fluoroscopy, theatre, mobiles, and computed tomography. And you're halfway there for expert practice in MRI.
So in practical terms, how much extra time are we talking about to be able to do sonography?
Right, the good point is it might take you up to 18 months because it's part-time. But the good thing is, once you're a radiographer, and if, say, Monash Medical Centre offered you a training position, you're paid. You continue to work as a radiographer. They pay you, and it's HECS, our Master of Medical Ultrasound, is Commonwealth supported. So you're not full fee paying. You're not paying, if you were doing graduate entry occupational therapy, Master of Occupational Therapy, you're paying up to $25,000 for that. You're at HECS, Commonwealth supported, and you're paid as a radiographer while you train and you study online with us. So it's a very good deal. And that's why the industry prefer radiographers, because they've had that very broad training.
I think we'll have to...
We have to
There's
love
another
and leave
session.
them. Okay. Thank you.
If you've got any more questions, we're out in the booth. Eh?